endometrial cells in where they're not supposed to be.
Okay.
And where they're supposed to be, it's the uterine lining. Yes.
So it's inflammation.
It's an inflammation.
It's an inflammation.
Process. Yes. Sometimes women are told, mwanamke ni kuvumilia and
exactly.
everything. And sometimes you're told to vumilia pain, to just be strong and everything. But period pain is not normal.
Period pain is not normal.
Yes.
Okay.
Period pain is not normal, and it is important for you to go and investigate. And I think some of the things is statistically it shows that most people end up not getting diagnosed.
Some people believe that when you have endometriosis and you get pregnant and give birth, it tends to disappear. Is it true? Fibroids and endometriosis are two different things.
Yes. Organs, and they can also go to other different organs.
So you can have endometriosis on your lungs.
Yes.
Wow.
Yeah.
Okay.
Yeah.
I thought it's only downtown.
No.
Oh.
No. It can happen in different organs.
Even on the heart. On the heart you can't have it. Hello, what up, beautiful people? How are you guys doing? I hope that you guys are doing great, because I am doing great myself. It is yet another episode of the CS Show, and guys, I'm truly happy for the love, for the support. I honestly don't take it for granted. You guys have been amazing to me. Asanteni tena sana. As you guys can see, tuko hapa Tamarind Tree Hotel, and mkijua mnajua kwamba it's about to get hot, to get hotter, because Tamarind Tree Hotel wako located pale Langata Road, and they have amazing facilities. They have accommodation, and guess what? We have officially opened our spa. So come enjoy. Bring your spouse, bring your your girlie, bring your boyfriend, bring your mutu, your mubaba, your mumama. You can actually bring them here, because our spa now, it is actually fully functional. And during this month, guess what? Tunafanya 10% on all mothers. So ukikuja hapa kufanywa massage na kupatia 10% on all mothers, because we celebrate women and we celebrate mothers here at Tamarind Tree Hotel. Also guys, to remind you kwamba this video is being sponsored by Fonsto Kenya, guys. Na mnakumbuka kwamba tuko msimu wa kucelebrate wa mama, mothers out there. We celebrate you and we honor you. So during this month of celebrating our mothers out there, we are going to be giving out one phone S10 plus, yes, to one woman out there, to one mother out there. No, as long as you have to tell me, well, why do you actually need this phone? Unatumianga simu kufanya nini? And for what purpose, for what reason? In case you're a business person, let me know why you need this phone, because I'll be coming to your hood and to make sure that you actually, enjoy your motherhood. And as I celebrate you, as we celebrate you as Fonsto Kenya. Just to mention on that, guys, we actually do have all gadget pale Fonsto Kenya. Talk about iPhones, talk about Samsung, talk about Huawei, any phone that you dream of, we got you covered anytime, any day. Located pale Kenyatta Avenue House, shop number 13. So guys, do make sure that you actually do shop with them, because we have the most legit phones at Fonsto Kenya. Alrighty. So guys, on today's interview, you guys asked for this specific topic, for this specific specialist. Nikasema humst my Muthoni wange there nikusikiza tu na kuleta. So guys, today I have, and actually honored to have this amazing woman on this podcast, and today we're going to be discussing topic concerning ladies, women, wanawake, ndo tujue how this thing it's all about. Before I talk about the topic, allow me to introduce Dr. Muthoni Mugambi. Hi. How are you?
I'm good.
You're good?
Yes.
You're well?
Niko salama, labda wewe.
I'm very okay. How are you feeling today?
I am more excited than I thought I would be, because this is an interesting topic, and I think it deserves our hearing.
Okay.
And for people to know more about it.
Okay, that is perfectly fine. I'm so honored to have you here.
Thank you
so
for having me.
some time back I'd asked for topics that people would want us to discuss on this show, because I have quite a number of people, especially women, that they love watching the CS show, and they told me like tulete specialist wa endometriosis. Mimi nikaanza kuza endometriosis tena ni nini wa jamani? What is this? So nikasema because sitaki kuwadanganya niwaambie endometriosis ni hii. I would rather bring someone to tell us what this thing is, in affect akina nani, what are some of the solutions, how do you know that you have endometriosis, like ina happening yaje, and some of that. So this is going to be your camera, but before we talk about endometriosis, kindly do introduce yourself on that camera, tell people who you are, what you do, and all that.
All right.
Yes.
So hi everyone. My name is Dr. Muthoni Mogambi. I am a young doctor, as you can see, and I am here super excited to share with you about endometriosis, passionate about maternal and child health, and I'm an avid educator of medicine. Other than that, I love public health. I like community health, that is preventive medicine, and I'm seeing myself leaning towards lifestyle medicine in the near future.
What's lifestyle medicine?
So lifestyle medicine is medicine, it's more or less understanding how your human body works. For example, nutrition wise, your body needs food, but it needs to eat at a particular time, in a certain quantity and particular foods that influence everything about it. Influence your mood, influence disease progress, influence so many things, including exercising. It falls under preventive medicine, so that is more or less it.
Hey, that's a new one. I've never heard of that.
Lifestyle medicine, yeah.
It's called lifestyle medicine.
Yes.
Oh, that's nice. I hope guys tunaland juu mimi sasa hapa. I'm actually looking forward to learning a lot from you, being that you're so educated and very young. How old are you, if you don't mind?
Do I really want to answer that
Women
question?
don't answer their age.
I don't think I want to. I am young enough.
You're young enough, and I'm so proud of you. Even taking that huge, that course C course rise. It means that you're an A student, yeah?
Yes. Yes, it
Huwezi kata, huwezi deny, but the age is where we draw the line. As women, we don't do that. So I'm so honored to have you, Dr. Muthoni.
Thank you.
We share the same name. Not the career is where we draw the line as well. So I'm so honored to have you around here, and I would really want us to discuss endometriosis. Personally, I came to know it when Nani passed away. Jay, what was her name? Yeah, the lady. The radio lady.
Yeah.
I came to know about it then, and I was like, hey, hii kitu ni nini? Because I think I let me not deny, I'm not that informed when it comes to that one. But napata pia ni watu wengi pia hawajui kuihusu. Unaweza pata mtu ako nayo, but you don't even know that you have it. So kindly do take us through what endometriosis is, and yeah.
Okay, so I'll take you through what endometriosis is, what it is by definition, and what are the prevalence, or how many people are likely to be having it without knowing, and also how does it manifest itself. So endometriosis, so endometrium is the lining that covers your uterus. So to have endometriosis means the lining, or the cells that line your uterus are located in other places of your body. So they can be in the fallopian tube. Fallopian tube ni the mishipa yenye fertilization happens. It can be in your ovaries. It can be in your attached to your large intestines. It can be attached to different organs of the body. And so when these endometrial cells are attached to these spaces, they then, once you are menstruating, or once you're bleeding, having your monthly bleed, then they're also bleeding wherever they are. So that, and wherever there is bleed and blood and everything, there is inflammation. There is inflammation, quote unquote uvimbe, like there's inflammation wherever that is, and that is why now it manifests itself inaonekana kama uchungu. There's inflammation that is happening there.
Okay.
So that is why inaonekana kama uchungu and pain. So wherever it is, it will manifest itself as pain in that place. If it's in the ovaries, you're going to have, your lower abdominal pains on the sides.
Okay.
You're going to have, a severe cramping during your menses, and maybe if it's also in the vaginal area, you're going to experience pain during sexual interactions. So that is basically what endometriosis is.
Okay.
Endometrial cells in where they're not supposed to be.
Okay.
And where they're supposed to be, it's the uterine lining. Yes.
So it's inflammation.
It's an inflammation.
It's an inflammation.
Process. Yes.
Okay.
Yes.
So when you're having your monthly periods, they also bleed.
Yes. So you're having your monthly period, it also bleeds. Why is it bleeding? Because these endometrial cells are sensitive to estrogen.
What is that?
To estrogen. Estrogen is the hormone that you produce as women during your monthly bleeding. So this estrogen, when it is being produced during that time of the month, it acts on these cells wherever they are. And so now it results to them bleeding and then inflammation in different sectors and inflammation, pain. Yes.
So how do you know that you have endometriosis?
So, it is said that 1 in 10 people, 10 women in the globe have endometriosis.
Okay.
So, and that is in every group of 10 women, there's one who might have it. It varies in severity.
Okay.
There are those who will experience this mildly, there are those who will experience the mild version, and those who will experience the severe version.
Okay.
And so those who will experience, and by mild, I'm not just saying pain, because different women perceive pain differently.
Yeah, that's true.
There are those even kwa kujifungua,
that's true.
kuna wenye
Inakuwa extreme.
Wanakuwa extreme na kuna wenye they can be able to manage it. Doesn't mean that those who are having extreme have the severe version. Neither does it mean those who are having milder have mini. But the question you've asked me, how do you know? Most times the biggest symptom that most people come with is painful menses. So you're experiencing extreme pain. And I think maybe even you mentioned of the myths that are there. Sometimes women are told, mwanamke ni kuvumilia and everything. And sometimes you're told to vumilia pain, to just be strong and everything. But period pain is not normal.
Period pain is not normal.
Yes.
Okay.
Period pain is not normal, and it is important for you to go and investigate. And I think some of the things is statistically it shows that most people end up not getting diagnosed or get diagnosed with endometriosis 7 to 10 years later than they are supposed to. Why? Because of the myths of thinking that I'm having period pain, I should just hold on tight and it's just going to disappear. And because it's just something that happens in a particular period of time, initially, you just want to overlook it, yeah? Because initially it might present with just period pain, and then as it progresses, then it becomes chronic pain that even persists beyond the time when you're having your normal menstrual cycle. So yes, initially period pain. And the reason I'm saying this is because, as we've said, statistics 7 years before people get the proper diagnosis, it is overlooked. And this is among teenagers.
Yes.
In high schools, you're just, I'm having cramps and I can't function well in class. You're told just take this and you'll be okay. But then it goes unnoticed for the number of years that we've mentioned, and then it progresses to chronic pelvic pain. So mainly period pain, pain during sexual interaction, and also the other one is also can be associated with heavy menstrual bleeding.
Heavy menstrual bleeding.
Yes.
Oh.
Yes.
Mi nimeshtuka hiyo story ya cramps. Guy, do you know, I think when we were growing up, we were just told that, especially the second day, when you're ukiwa like on periods, you're supposed to expect, definitely heavy bleeding and some cramps.
Yeah.
So period is not supposed to have pain. You're not supposed to feel pain when you have it.
Yes. I will say emphatically yes, because if I say kuna kidogo, understandable and everything, because of also what is happening during that whole period, there might be some discomfort.
Yes.
But at this point in time, I'm talking of pain,
yes,
that even progresses to the point whereby everything stops.
You can't
you can't go to work, you can't go to school. If you're in school, you have to take a leave out. No, that is not normal, and it's good for you to go and have some investigations done.
I honestly feel like, especially in primary schools and secondary, this should be a topic, or maybe like a session that should be had.
Yeah.
Because I feel like most of, especially our young sisters and our young whatevers, they should know about this, because I think we tend to ignore because of what I've told you. We are told that kunafaa kukuwa na pain. So napata nikifilio hizo cramps, I just take a hot water bottle, I put it here, and I'm okay to go. Forgetting that I'm not supposed to feel that way. As much as kunafaa kuwa na hiyo discomfort, but not pain. Yes. Hey guys, please listen carefully, and take caution by then. Also listen to your daughters. Take caution, because I think the earlier the better, right?
The earlier the better. Talking about young girls and everything, I have come to see that some young girls develop polycystic ovarian syndrome, just to digress a little bit, and with that, even in high school, and it goes unnoticed, someone received their periods, and for quite a long time they don't get their periods again. They are gaining so much weight, and it's just considered kawaida. But I think it's something that we should keep our radar, or our antennae up, so that we don't miss some of these things, and they go unnoticed.
Hey, me nilikuwa nasikianga one of the myths nilikuwa nakuambia hapo behind the camera, I was telling you, some people believe that when you have endometriosis and you get pregnant and give birth, it tends to disappear. Is it true?
Okay, now that's a very interesting question. Reason why it's interesting is because, well, we've said the reason yenye kukona all this bleeding is because estrogen is active, and it's the biggest hormone that is being produced. And so you find that during a pregnancy state, estrogen
is not part of
peak.
Haifanyi.
So at that time, kila kitu imetulia, imelala, and everything. So up until now, the pregnancy and your hormones have now come back to normal system functioning, that then things end up coming back, or the pain ends up coming back, because the endometrial cells, wherever they are they are still active. So there is some truth in the sense that during pregnancy, yes, there might be not so much of that pain, but post-pregnancy, I do not believe that.
So let me ask you, during, let's say for example, there's a lady that is pregnant right now, nakona endometriosis, and you just told us that in the endometriosis, like, it is that inflammation that ina form apo either kwa hiyo lining kwa uterus, right?
Endometrial cells,
it is the lining on the uterus,
but hizi lining
ziko kila mahali. So do they grow during these 9 months, or they just those do they?
Well, those cells, wherever they are, during the pregnancy, I think because of the estrogen being absent temporarily, they are more or less dormantish. But once this person or someone who's not pregnant, these cells, wherever they are, they end up, we call developing their own blood vessels, their own nerves and everything, such that now they can just be inflaming, and as they inflame, as they be inflammation kwa Kiswahili
Uvimbe,
yeah. They end up inflaming, and now these nerves that are already being formed will result to now pain at this point on a constant.
Mi niko na swali lenye sitaki kukosa kuuliza.
Okay.
Is fibroids and endometriosis, they're two different things.
Yes.
They're two different things.
Yes.
But pia for fibroids, it's the same thing. Ni uvimbe tu, ama?
Yes. So
Okay.
fibroids ni yes, as you've said, ni uvimbe. See inflammation ni when we say ni kama mass. Ni mass ambayo it's not a cancerous, it's not a cancer, but also it has its own potentials of that, but it's not a cancer.
Okay. Endometriosis is cancerous.
No.
Okay.
Like endometriosis is, well, endometriosis can result to different complications wherever it is.
Okay.
Yeah.
Okay.
And we are going to talk about the complications that come with endometriosis.
Okay.
But fibroids ni mass, ni, what do you call it? Yeah, ni uvimbe. Yeah, it's an uvimbe that is there in the uterus, and so it is taking up space. And it is receiving blood, so much blood, and it is resulting to heavy menstrual bleeding and sometimes subfertility because it's taking up the space where the baby is supposed to come in. And maybe it's also one of the many causes of miscarriages that happen. Yeah.
Oh my God, I think we'll have another segment of talking about fibroids, but for now let's talk about, because nishaanza overthinking, nishaingia kwa uterus sasa naanza oh my God.
Yeah.
Oh my Lord. So you were talking about some complications about
so depending on where these endometrial cells are located, they will have different complications.
Okay.
So if they are located, they are attached to the small intestines or the large intestines, and they're causing inflammation there, you're going to have
they can go.
Yeah.
I thought it's only on the
they can go to the nearby organs, and they can also go to other different organs.
So you can have endometriosis on your lungs.
Yes.
Wow.
Yeah.
Okay.
Yeah.
I thought it's only uko downtown.
No. It can happen in different organs.
Even on the heart. I'm on the heart, you can't have it. Endometriosis of the heart, that's a new one.
There are possibly research that has gone, probably there are. I haven't read of any, but I know that there are.
Okay.
Endometriosis of different organs. So depending on whichever organ is being affected, so you might have constipation or diarrhea, if it's the small intestines that are affected. If it's a fallopian tubes where the fertilization happens, they can occlude. Juu imeinflame, alafu ikaform hivi fibrous, ikaform kitishu tu, ina occlude hiyo njia. So you might ina block. So inamaanisha mtu ana have a difficult time getting pregnant, and maybe if it is affecting the muscles of the uterus, that one we call it adenomyosis. Yes, adenomyosis. And then it results to heavy menstrual bleed. If it's affecting the vaginal area, it results to painful painful sexual intercourse. And if it's affecting the urethra, njia ya mkojo, ina cause painful urine or even bleed. So the complications there will point to even the symptoms, but also the other complication is unapoteza damu. Whenever you unapoteza damu, chances of you getting anemia are high. So people might present with anasikia tu kizunguzungu. Sometimes you even collapse, or sometimes you have so much fatigue in your body because your blood levels zinaenda zikipungua. So that is why it's very important, if you are having all these symptoms, it's good to see a doctor. Yeah.
Is there like any cure to it?
Well, I will say there's management. Yes.
Okay.
I will not tie myself to say there's a cure, but I will say there's management for it. There's treatment to manage even the symptoms and even its the symptoms. So for management, what we are having here is pain. And sometimes you'll be like, oh, I can handle the pain, but this pain, if it's not managed well, it can result to chronic pain. And in chronic pain, unasikia like chronic pain ni mwili mezoea uchungu to the point that unajua kuna kwanga na inaita thermostat ya uchungu kwa mwili. So hiyo thermostat inaweza kuwa inasoma vitu at such as low level such that hata kitu ndogo tu inafanya unasikia uchungu hujaisikia, you're constant, because the thermostat was reset, you're constantly feeling pain even when hakuna kitu inafaswa kukuwa inasababisha the pain. So there's treatment, and I would encourage, this is an awareness campaign and not necessarily a subscription. There's treatment, you get pain management treatment. You depending on the diagnosis that will be made with a doctor and a gynecologist, it can result to laparoscopy.
What is that?
Laparoscopy is ni njia ya upasuaji, but yenye you don't have to open up the body, anything. You just insert two tubes inside someone's body na inaweza kuclip hizo endometrial tissues. So but that is in depending on the gynecologist's review yenye atakuwa amekuambia. And yeah, so there's the pain management, and I think the other thing, it's endometriosis is a tunasemanga ni biopsychosocial condition. To mean kuna the condition that is happening kwa mwili, but pia it has a way of hurting someone psychologically. Because this is someone who probably is employed.
Yes.
They have to always ask for leave outs, or
true.
they are constantly in pain. And sometimes people are like, kwani wewe, you're always, unajua unajisikilianga huruma sana, you're always feeling, kwani other women don't go through the same nini. And it's a social condition, because you need support. You need people around you to understand the condition that you have, that you are able even to navigate through all this. So even therapy, even being around a supportive system of young women probably who have gone through the same things. And I know there are many support groups out there. Endo Warriors is one of them. And I think it's good to also be part of this, to just know that you're not the only one going through all this alone. And as you were mentioning behind the camera, that there are other, I will not say they are, the only management ways, but there are other ways. Pain management, you in addition to you taking drugs, there are different ways you can manage your pain, as you're saying, the hot water bottles, the different kinds of massages, things that can relieve your tension in your body, and also nutrition as well.
Or what you eat is important.
What you eat is very important. There are foods that are significantly inflammatory to mean ina cause mwili yako ikue on a stress mode the whole time. So kuna vyakula ukikula and they are pro-inflammation kumaanisha inafanya mwili yako ikue on such a stress state, stressful state, which you cannot just you can also develop things like cancers, you see. And so nutrition is also important and significant in all this. So as I have said, there's the medical treatment, there is the psychological treatment to things, spiritual support that someone who's going through this endometriosis journey needs in their care.
Do you feel like Kenyan women are more are aware of this endometriosis?
I think with the advent of social media and people now being more confident to share their journeys, I am commending everyone who is willing to share their journey and even to tell people about it. Now people are getting to know. But I don't think it's all Kenyan women because maybe someone who does not get a smartphone or in a remote setting might not necessarily understand nini inaendelea. So
me personally, I think that it should start from uko chini kabisa tukiwa shule. Hizi ni vitu vingi by the tungekuwa tunaambiwa tukiwa shule, tukiwa primary. See, like the same way mlikuwa mnatuletea pads mnatupea. It should be taught there. Because like I said, you'd even find even maybe my sisters on feeling your pain your period and they take it and they ignore because in their mind we know we're supposed to feel that pain. But my sisters, please be woke and every woman out there, in case just don't ignore. Imagine don't ignore.
And now information is power. Like you can just ask, hi AI, teach me endometriosis in a layman language, and they will be able to teach you. But sometimes, unless you know there's this thing, you might not be able to identify it. And it's good that you're doing this, educating women, because I know this might help a few. It
will help. Actually, it's them that asked me to bring someone to talk about endometriosis. It's because I think pia tumekuwa tukiona stories mob sana. Also, there's I don't know if you know Natalie Githinji. She's actually has that, and pia anatufunzanga huko mambo mbili tatu. But I'm like, you know what? It's good to learn from you also, and also would want to bring her also on this show to scare tu pia story yake
their own life story.
Exactly. Hata kama si like any other person that maybe is going or is still going through that. Endometriosis, and I understand that it's very expensive to manage it as well, right?
It is like any condition. There is a cost implication tied to it. I think it's because of its chronicity. It's something that's long. It takes long, and I think the other thing, Niju, it's pain. So if you are having pain, mtu akipitia hapa kwambia unajua ukikunywa mwarobaini utapona.
Imagine utakunywa
unatoka 1000 zako 2 unajua because you're in pain you just want to relieve it. So sometimes the desperation can result to people just trying anything and everything that is there, and that might contribute to the cost implication to it. But I also think maybe even for anyone who's out there, who's up, in the policy, people who are making policies for us to ensure that even this is included in our care packages, such that our social health authority SHA and everything inaweza cater for hizi vitu zote.
Sometimes you were disappointed by the way na some women rep because you see we appointed you to represent us.
Yeah.
And if honestly some of these things we are not able to table them down for us, because we cannot be, maybe my voice is not enough loud enough to be heard, but their voices are very loud to be heard. I get like it's very expensive, and these are women that for real, for utapata kuna wengine wako Turukana, they don't even know anything. They don't even hata facilities or mahosi ziko mbali. You understand? They don't even have the knowledge about it, but we still have people in government wenye honestly they're not even coming up with solutions to help these young ladies. Like I said, it should be a conversation in schools for us to stop, tusikue na watu wengi sana nyo napitia hizi. If we can try manage it as early as mtu akiwa na miaka 12 ama hata 13. Ukijua ni hivi, you know what to do. Tusingoje mtu akiwa nazeeka.
And
the more you stay with it,
sub-fertility issues, only for you to realize it's something that you could have.
Imagine. Please, our government out there, if you're watching and maybe you are government, please, we are pleading with you. We women, honestly, we need some of these, information. Mkiweza tu ongeza tu kwa syllabus ama sijui ni wapi, whatever you guys are going to do, just to educate these young people. Ndio tusikue na stories mingi kama hizi. Yes, kindly. That would be my request. Do government support these ladies with endometriosis? Ama ni kaguna nje bebe kivyako?
Well, I might not necessarily be in a good space to speak for government, but I will say there were a while ago, programs or even the initiative to have this in the KICD, in that, how do you put it? Well, I'm mentioning names that I don't think they have sent me to mention their names here, but into the curriculum, I must say. So we really hope that in the fullness of time, these are some of the things that they will incorporate, as you're saying, they will incorporate in public health information that is being dispensed in school, primary, high schools, that more ladies are aware of the conditions, conditions that they might face or they might have in a very simplified way. But I know of very amazing doctors who are doing great work out here. Dr. Njage is one of them. He's an endometriosis specialist, specialist, and so I think there are many doctors out here who are doing a good job.
And by the Dr. Njagi does a very good job to inform us pale TikTok. Bando zinaishanga tukiwa tu hapo tukitaka ku learn about this thing, because I feel like now women, especially with the social media, they're more woke and they want to learn. But also ladies, don't stop learning. Imagine it's very important at least to know and to understand, and also don't ignore some of these things that we have talked about here. Hata kama ni sister yako, mtoto wako, also like she said, listen to your kids. Just listen to your kids. Don't let it
be like, even me, I used to have, because sometimes it can have genetic, inaweza kuwa na inafuata familia, such that your daughter says, "Mommy, I'm having very painful cramps," and you're like, hata mimi nilikuwa hiyo miaka yako ilikuwa inanitesa sana. But this is probably something that you can have checked and arrested early enough.
But me ushanga, is it because of our eating habits or what? Because me, I never heard of this thing before, but they came to learn about it some few years ago, and it's because of now akina Natalie. Sijasikia shosho yangu alikuwa na hizi ugonjwa. Sijai. So I'm like, is it like, what is it? Ama ni kitu mpya imeku, ama it's because we were not even informed about it.
I think unajua ni kama venye watu wanasema, unajua kitambo hakukuwa na cancers and everything, but chances that they might have been there. It's just that they were not documented. And with social media, if you did not know Natalie at a personal level, unless you had a phone,
that's
you would
true.
not have known. And there are many people out there. So it's because there is more voice to it, more research going into it, more people studying about it, more people being diagnosed. Juu kama kitambo mtu alikuwa na uchungu and then there's no diagnosis. So unadhani haiko but niti haijakuwa diagnosed. Yeah.
I hope you guys have learned something from this whole conversation because for me hata nimeshanga at you can actually have lung endometriosis kwa lung. I didn't know. The thing imenishtua. I'm like, whoa, I think it's because I know it's a, it's a menstrual thing. I expect it like to be down there. I didn't know that you can get that inflammation on your oh my lord. Na mimi nakwanga paranoid.
So
I'll be so keen what is that? But I'm so happy to learn, by the way. I'm so glad that I invited you on this show because information is key
power.
And it's power, by the way. Thank you so much for hata kutu enlighten na kufanya sisi tunajua tunalana. I know my audience are so happy because they asked for this conversation and I'm so happy to have you and for us to to understand even much better and everything. So before we wind up, I would like you to talk to this camera. You just tell people more about you, what you do, where they can get you, where they can find you. Yes, you market yourself, pale.
All right. So my name is Muthoni Mogambi, Dr. Muthoni Mogambi. It's been a pleasure having you here.
Thank you.
Being here, listen to me saying having you here. I felt so comfortable at home. So, and it's been good even having this conversation. And so I'm very much interested in educating, maybe trying to simplify all the medical information that we have out here, more or less medical education, and that is basically what I'm doing. I'm doing a lot of work in community health, and that is teaching people more and more or preventive medicine.
Okay.
That is basically what I'm doing. And you can find me on Instagram. I need to join TikTok. I am missing out on that.
You are.
Yeah, but you can find me on Instagram as Miss Muthoni, and I hope to engage.
Okay.
More. Yes.
Thank you so much again for coming to this show. We really do appreciate even you sacrificing your time for us. We don't take it for granted. We appreciate you and we celebrate you. This month, are you a mom?
No, I'm not.
But I still celebrate you. I still celebrate you because you're a woman. I celebrate you and continue doing what you're doing for the society, for us ladies, for kids out there. We truly, truly do appreciate your work. May God bless you for that. And guys, that is it for today. And I hope that you guys have learned one or two things from this conversation. I hope to see you guys next time. In case kuna kitu ungetaka pia to rekebisha next time, or maybe you would want us to bring someone on our next episode, do comment on the comment section because we love your feedback. And asanteni sana so much for watching this amazing episode. Till next time, bye.